Good morning to all of you. Today, as we are coming close to the end of the Breastfeeding Week celebration in India, I would be reinforcing the importance of breastfeeding and tell you about certain pertinent aspects which we should know about breastfeeding. In India, annually 26 million babies are born, and among these 26 million babies, approximately 18 to 20% are born below 2.5 kgs, and about 13% of them are born before completed 37 weeks of gestation and are called preemies. Those below 2.5 kg are called low birth weight. Now, whether the baby is low birth weight, whether the baby is preemie, or the baby is term, all of them are at increased risk of sepsis due to various reasons, and approximately 14 to 23% of this large birth cohort gets infection. So breastfeeding is important for the term babies, for those above 2.5 kgs, but it is equally important for those who are preterm, who are sick, because for them there is equal or even greater benefit of breastfeeding. Now, what are the advantages of breastfeeding? When we talk about breastfeeding and its advantages, the breast milk provides optimal nutrition to the baby. It enhances or boosts the immunity of the baby and prevents them from infection. There is a mother to infant bonding, which is good for both the child and the mother. There is healthy growth and development. The risk of chronic diseases later in life becomes less, including hypertension, diabetes, and asthma. There is reduced risk of sudden infant death in these young infants. Now, the sick and preterm infants, what about them? Now, when the baby is in the uterus of the mother, at around 28 weeks, there are sucking and swallowing activities, but these sucking and swallowing activities are not synchronized to result in swallowing milks and breastfeeding. So if a baby is born really preterm, around 28, 29, 30 weeks, the baby cannot directly suck from the mother's breast. Around 32 to 34 weeks of gestation, the baby has coordinated sucking and swallowing, and then they can be put to mother's breast and they can suck milk. Now, for all these babies, breast milk is important. So if the baby cannot suckle because he or she is extremely preterm or sick, we have to give them breast milk either by expressing mother's milk or by, if we have a milk bank, then giving them donor's milk. The last option, of course, would be that we give them artificial milk when feeding is allowed. Now, this milk can be given by a orogastric, nasogastric tube, by gavage, or it can be given by a peladi if the baby can suck and suckle. Now, even if small quantities of breast milk are given, because the baby cannot tolerate full amount required for age, it will benefit. It will prevent necrotizing enterocolitis, bronchopulmonary dysplasia, and if the baby is not infected, prevent from sepsis itself. Now, when we are having a mother who's got a preterm baby, she has an emotional trauma that she can't breast milk. We can help her get over this trauma by counseling her to express milk. In the first couple of days of life, the expressed milk can be few drops to about 120 ml, but later on, around 10th day, 12th day, it can be as much as 720 to 750 ml. Now, this expressed breast milk is precious. If we don't have a milk bank, we can follow the rule of 3, which says it can be kept in room temperature for 3 hours, refrigerator for 3 days, and in a freezer for 7 days. This breast milk should be offered to the baby. Now, to promote breastfeeding and breast milk, we have this baby-friendly hospital initiative, which says all babies should be fed within 1 hour of birth. Yet, only 40% are fed within 1 hour of birth. It varies from hospital to hospital, from state to state, and it's our duty to ensure that almost all the babies are fed within an hour of birth. And continuous breastfeeding for 6 months should be there. In India, approximately 67% have exclusive breastfeeding for 6 months. Now, the Baby Friendly Hospital initiative came in 1991 with 10 steps, which were having a written policy on breastfeeding, for staff training, for antenatal education of the mother, for giving them immediate skin-to-skin contact between mother and baby, initiating breastfeeding within 1 hour, exclusive breastfeeding for 6 months, rooming in of the infant and the mother, having cooperation and responsive feeding from the mother to the baby, and avoiding artificial nipples, and having the support to the mother following discharge. Now, if we ensure all this, then the baby will have the benefits from the breast milk. In 2018, certain modifications came in the breastfeeding step 1, step 5, step 9, the details of which can be read further, and they were based on the evidence generated by WHO in the 2017 consensus meeting. Now we have to keep commercial milk products out of the hospital. If we want to use them, we should keep them out of the view of the public, parents, keeping them in generic containers, and fortifiers, pacifiers, artificial nipples should not be used. And also there is a limited use of breast milk fortifiers based on evidence. So with this, I end with saying that breast milk is the golden mantra for a newborn. We must ensure and support the mothers for breastfeeding by telling them the advantage, helping them position the baby properly, ensure the baby is latching well, and continuously support her for the next 6 months. We should have policies in place and programs in place to ensure essential breastfeeding for all newborns. Thank you very much.